have fostered roughly 47 kids over the past 10 years, so definitely have a lot of experience. Currently, our oldest is transgender, who also has autism and ADHD, so definitely been around the block just a little bit. So I always like to start off my presentations with bias. And so if you don't know what bias is, we all kind of have biases, even if we have preferences or aversions to individual groups or people. Implicit bias is a term that we use to describe when we have attitudes towards people or associate stereotypes. Sometimes this is with or without consciousness of that bias. Sometimes it's how we are raised. Sometimes it's when you think about cartoons and video and things like that, that all plays an impact of how you see and view the world. If you think back to like when Disney used to present some kind of what I consider like off the wall cartoons that were kind of racist, that all kind of goes into bias and how we see and view people from different backgrounds, ethnicities, religions, all those things kind of come into play. And so I always like to start off with vocabulary. I feel like this is what usually trips people up, is terminology and vocab when it comes to the LGBT community. And so lesbian, obviously woman who's primarily attracted to other women. Gay experiences attraction solely or primarily to some members of the same gender. Bisexual, that's a person who's attracted to both men and women. Transgender is a person who has transitioned from one gender to another. Queer is an umbrella term used to describe individuals. It can kind of, it's encompassing of kind of any of the LGBTQ people. It's kind of a term that was derogatory, but as a community, everyone has kind of decided to take that back as a term and use it as a positive thing rather than a negative thing. Intersex, this is one that's often missed, skipped, avoided. Intersex is usually someone who is born with both genitalia or both sex organs. Let's see, there's approximately 1 in 2 babies born out of every 1,000, so it is more common than what you think. So how they determine is a refrigerator magnet determines whether you end up being a boy or a girl, depending on the size of your external genitalia. And then asexual is somebody who experiences little to no sexual attraction to anyone. And then gender identity versus sexual orientation. This is what usually trips people up also. So gender identity is who I identify as. Sexual orientation is who I go to bed with. So gender identity refers to someone's own personal sense of being male, female, both, or neither. Cisgender is when a person's gender identity or gender expression matches his or her sex assigned at birth. Transgender is a term best to describe someone who does not align or is not congruent with their gender identity or expression that was assigned at birth. Non-binary, that's an idea that there are only 2 genders, male or female, and people who do not feel like either fall under the non-binary. Sexual orientation, the type of sexual, romantic, or emotional attraction someone has for someone else. Sexual preference is just the preference one shows for sexual interest towards somebody or the opposite sex. And then gender identity versus gender expression. So best described, gender is one misconception about gender is that it's based on just a physical understanding of sex, that not everyone fits into a binary box, either male or female. Due to this misconception, it turns into leading and may assume that someone is born determined gender at birth. However, both genders and sex are more complex. Gender expression is expressed through someone's physical appearance. So I cut my hair short, I dye my hair a certain color. That's all how I would express gender through clothing, jewelry, scents, so such as perfumes, those types of things. That's how someone can kind of look at somebody and then identify how they express themselves. And then, of course, some people align more with being masculine or feminine, which when you think of masculine and feminine, I like to think of this as more of a linear type line whereas some you have really masculine men, whereas you have really masculine females also, and then kind of vice versa. It can kind of fall on that continuum. Is there any questions so far?
Hey Levi, are you supposed to be sharing your screen right now?
Yeah, is it not?
No. I wasn't sure if you were just having a conversation with us, so I didn't want to like interrupt. You were doing great.
Yes, I am supposed to be sharing. I'll
Okay.
start over real quick. Okay. Can you see that now? Okay, perfect. So this is my bias slide, obviously, just kind of talking about bias. And if anybody has any questions, go ahead and jump in at any point. Vocab term, lesbian, gay, bisexual, trans, queer, intersex, asexual, and then gender identity versus sexual orientation. And then gender identity versus gender expression. I've included a lot of gender expression resources. So this is if you have a kiddo who wants to identify as another sex, such as a trans kiddo. There's all kinds of resources here that we use at the hospital at Children's Mercy for our trans patients. And then just some good resources. If you have a kiddo that's wanting to transition or thinking about it, then you already have some resources to be able to access. So here's a slide that I usually like to cover. It's inclusive language, do's and don'ts. So hermaphrodite used to be an old term, now it's intersex. So hermaphrodite was stigmatizing. Best practices kind of now is intersex. I do feel like with terms and terminology, it does ebb and flow. It does change. Sometimes it is hard to keep up. So as a parent, even somebody who I'm gay myself, right? But sometimes it is hard to keep up, even for myself, who I'm in the community and pretty active and involved and present on this stuff regularly. Sometimes it's still hard to kind of keep up with the addition of letters and different things like that. So give yourself grace in those aspects. So derogatory terms, homosexual, usually just go with gay. Just kind of inclusive of all people. Born female, born male, assigned at birth. So just assigned female at birth, assigned male at birth, just kind of allows a little bit more flexibility there, not so specific necessarily. Gay or a transgender. Again, we're people first. And so a gay person, transgender person, a person who has lived through a transgender experience, any of those are kind of what we would consider okay terms. Transgender people, normal people, transgender people, and cisgender people are normal people. And so while we are different and identify differently, we're all people at the end of the day, kind of is what this all kind of ends with. So both genders are opposite sexes, just kind of all genders, just a lot easier to encompass and cover everybody. When you are kind of talking to a crowd, instead of saying ladies and gentlemen, everyone, folks, however you want to kind of word it, just kind of encompasses everybody because you don't know how everybody identifies. Mailman, fireman, policeman, mail clerk, firefighter, police officer, just kind of changing those terms, making them a little bit less gendered. And then obviously they, a lot easier to refer to somebody as a they rather than an it. Any questions so far? Alrighty, okay. So the gender unicorn is what I like to use with younger kids. I've seen kids as young as 2 all the way up to 22 in my professional life. And so I like to use this because it kind of breaks it down, gender identity versus gender expression versus the sex assigned at birth, and then physically attracted to, and then emotionally attracted to. So just because somebody identifies with a specific gender doesn't mean that they're physically or emotionally attracted to somebody of either the same sex or opposite sex. It really is person dependent. And so I like this because it just kind of shows that fluidity and how it kind of breaks them down. just because I identify as a male doesn't mean that I necessarily will express myself as a male all the time. For instance, if I was to do drag, I would obviously be emulating and dressing and expressing myself as a woman. So easy to think about. Gender person is what I typically use with my older kids, or teens, or even adults. And I like how it breaks it down into how you identify versus your attraction, expression, and then your sex. Again, it kind of falls on that continuum. So sometimes I will draw a line simply and then have woman, male, or woman, men. And then what I'll do is I'll have the kid kind of draw a line of where they feel like they fall on that. And you get some interesting perspectives when you have kids kind of express that themselves. And then, of course, feminine, masculine, where do you think you fall versus where ideally would you like to end up being, is usually conversations that I have. I like this one also because it does show identity doesn't necessarily equal how you express yourself, doesn't necessarily mean sex, and then gender doesn't equal sexual orientation. All right, so obviously I like to show people who are trans and transgender experiences. I like to do this because I don't know what it's like to be trans. I don't know what it's like to identify as trans. I can speak to obviously like the coming out story and things like that of being able to come out and identify a certain way. And so I do like to show this video just to kind of show how they interact or have had interactions with the healthcare system and kind of stigmas of certain things. And so it's one of the better videos that I like to show.
My name is Leo Sell, and my pronouns are they, them, there.
My name is Sophia Stanford, pronouns she, her.
I'm Gray, and my preferred pronouns are he, him. Robin Kanauer-Hasa, and I use feminine pronouns, so she, her, hers.
My name is Luke Jude, and I prefer he, him pronouns.
My name is Chloe Flora. My preferred pronouns are she or they.
"99% of the time when I go to the doctor, I'm anxious and nervous.
Even though insurance and driver's license and everything says female, you really don't know what to expect.
Yeah, I don't think I know any trans person that went through the medical system and had a nice time with it. But not in this country.
I haven't gone to the dentist in 4 or 5 years because it's just such an uncomfortable experience.
I know people who, if they sprain their ankle, will just wrap it up and put some ice on it rather than going to the ER and having an x-ray done, because it's just not worth the stress.
I had a history of urinary tract infections. It was pretty commonplace for me. And I went to the urgent care, and the physician on staff that I was dealing with kept telling me over and over how atypical it was for a man to be having a series of urinary tract infections. I tried to interrupt him and say, I understand, I've been through a gender transition, so my anatomy is probably not what you expect it to be. And he kept stopping me. He wouldn't let me complete and assuring me that he did understand. And he said, I think I would like to take a look. So I pulled down my pants, and it wasn't at all what he expected. And he was immediately apologetic. He said, oh, you don't have, oh, I'm so sorry. I didn't realize. I said, I know, we tried to tell you.
I initially knew I identified and felt female around 5 years old when this was caught out by my family member who was the director of mental health for the state that I lived in, essentially required forced correction, like invasive hypnotherapy, corrective assignment and orientation to gender roles, other things to help masculinize and or reprogram the viewpoint of the world to the child. If I had to be this way, I'm going to walk in front of a car and I'm going to reset it and try over. That's what I thought when I was 6.
I had a bunch of different symptoms tied to sleep, tied to appetite, weight gain, mood that had sort of increased in severity over a year. And one of the things that my doctor told me to do was check myself into a hospital next time I had my round of symptoms. So I checked into a hospital. And even just within the check-in process, I was misgendered. I finally spoke to the doctor, and he came in and was speaking to me as if I was a 13-year-old girl. And all of my symptoms were surrounding hormones. And when I started talking about hormones, this doctor in the hospital actually looked at me and said, "Oh, what do hormones do? I didn't think hormones did anything." And he actually checked me out of the hospital. He said, "I think that you're just bleeding a lot right now." Fast forward 3 days later from this hospital visit, and I was diagnosed with invasive hormonal breast cancer that tested 99% positive for estrogen. And I think that if I had had the same list of symptoms, but was a cisgendered man, I would have been treated completely differently.
So in general, I've been blessed with a good primary care physician and an endocrinology doctor, but I was seeing a specialist for a different medical problem, and my records and everything all said female. I have everything changed. And the guy looked at it, he went through all of those steps and then said, "So do you dress full-time as a woman?" And I was stunned. It's like, "Do you dress full-time as a man?" Yes, I'm a woman. I'm a woman of transgender experience. And of course, it's just like any other woman in your office.
The biggest horror story that I had was going to the pharmacy to pick up my first testosterone prescription. I was nerve-wracked already because it's like such an emotional thing to like finally get that golden ticket. It ends up being like $1. So it's just the syringes. There's no medicine. 4 people later, in about 20 minutes, they finally look it up in the computer and they're like, "Oh yeah, oops." Throughout this entire process, I have to say my legal name, which isn't the name that I go by, out loud to the entire store. And I'm basically outing myself to everyone around me. And that's not wanting to hide. That's just about trying to stay safe. Like some people hear that and they might follow me to my car and bash my head in.
During one physical therapy appointment, I had one of the therapists misgendered me to an entire room of people, both other physical therapists and other clients. He never looked me in the eye again. He never talked about it. He never apologized. It was just this weight. And especially me as a trans woman, I get misgendered all the time. Like, it's something I deal with on a near daily basis. So to have that happen in a medical setting, something where I can opt out of, even though it might not be the healthiest thing, I will. I'd rather protect my own sense of mental health.
So I'd like to get some of your guys' initial reactions to that video. Is there any comments or anything anybody would like to share?
I'd like to share something if I could. It's kind of a question and a statement. Trying to find my little thing. So we have a really close friend who is transgender, and the way he describes it is that when somebody uses his past name, or he calls it his dead name, it hurts him. And how can you explain kind of how that works? Is that, I don't quite understand that.
So I think oftentimes when individuals transition, right, it's kind of leaving who that was in the past. And then when the dead name, old name is constantly brought up, sometimes unintentionally, sometimes it is intentional, right? And so it can be out of spite, meanness, whatever. It does kind of set that person back a little bit. It feels like you're never going to really be who you identify as. And so I like to, when I'm talking with groups and things like that, it's no different than if someone has a shortened name that goes by a shortened name, right? So if you go by CJ rather than some other name, or you go by your middle name rather than the name that you were given at birth, right? Those are all kinds of things, right, that people could be accommodating, but I think it's different when you have a person who has or says that they identify as being a different way. And so I think people sometimes do it intentionally rather than unintentionally. And so when there's that intentional piece behind it, it just hurts and stings that much more. It's even like for me, right? I feel like I have to come out almost constantly, or when my kids go and play with other kids, I always have to let the families know of like, hey, my kid has two dads. I don't know how you address it in your home. Just want to give you a heads up. This is kind of the situation. My child doesn't have say of who adopted him, right? And so he doesn't have a choice in that. And so I don't want something to come back on him because of the family that he was adopted into. Does that kind of answer your question?
It does. Thank you very much.
Yeah. Any other reactions or thoughts? Alrighty. Okay. So at Children's Mercy, we do have the Gender Pathway Clinic. This is usually for kiddos anywhere from like 2 all the way up to 18. At 18, we usually transition to KU. KU is one of the only adult facilities in or around this area that treats transgender patients or that population. So it is a multidisciplinary clinic. They do provide support after diagnosis of gender dysphoria is provided. So one of the things that I always like to let parents know is that you're going to want your kiddo in consistent and long-term therapy. The reason for that is because that gender dysphoria diagnosis, we want to make sure that it is current, and then obviously they're seeking therapy and working through some of the issues that go along with that. And so services that we provide for gender questioning youth also, children and adolescents who are questioning their gender identities, transgender, gender non-binary, or gender fluid youth. Sometimes it's as simple as we can give them a hormone blocker, which allows them to give a little bit of time to then determine which sex you want to identify as versus actually starting hormones and going through all that. We do provide hormone therapy for children under 18. I think where people usually get hung up is that we're surgically changing kids, and that is not at all the case. Yes, hormones are a little bit more invasive, but those are usually the kiddos that are pretty consistent, persistent about what they want to identify as and who they identify as. So some of the criteria that we usually use in clinic for those diagnoses and to be able to prescribe medications is, are they identifying as male in all domains of their life? So are they dressing that way at school, at home, out in the community, or vice versa? Are they identifying as a female in the community, at school, at home? All of those things we kind of take into consideration in treating and options. And then obviously we always like to partner with parents and then allow them kind of that decision-making as well. I've also attached 2 additional resources. Both are from Children's Mercy. Both are just super helpful in tips and talking about sexual orientation with your kiddos, or talking about gender with your kiddos, or how to bring things up, how to word things, all of those things. Super great resources there. And then I always like to throw statistics in here because at the end of the day, why are we talking about this? Why is it important? So reasons to address sexual health and sexuality within foster care youth. So based on 2019 data, 30.4% of youth in foster care identify as LGBT, which is a pretty significant amount of youth when you're talking about already a small subset of youth that go into foster care already, and 30% identify as somewhere on the LGBT spectrum. So 44% of LGBT youth who are in custody reported that they were removed, ran away, or were thrown out due to reasons directly related to their identity. That's a pretty staggering. So almost half of the kiddos that are in care were removed or were thrown out due to their identity. So 57% of trans youth report family rejection. Data shows that LGBT youth are only 5 to 7% of youth populations that are 13. Oh, I'm not reading that correctly. Data shows that LGBTQIA youth are only 5 to 7% of youth of the population, and that of that are 13 to 15% of those connected to juvenile justice system. So what that means is essentially there are higher rates of LGBTQIA youth involved in the juvenile justice system. And then based on 2022 data, 44% of LGBT youth report that they have considered attempting suicide. And then Kansas specific data. So Kansas population is currently 2,935,000. And then of that, 19,000 are youth ages 13 to 17 who identify as LGBT. In 2021, Kansas averaged 5.8 moves per every 1,000 children in care, and then 7.29 moves not specific to gender or sexual orientation. So what that means is in that year, 5.8 moves were the average for every 1,000 kids in care. And then in 2022, 7.29 moves were occurring for every child in care. And then LGBT youth enter care for reasons like abuse, neglect, parental substance abuse, family rejection. Data shows that these youth are 2 to 3 times more likely to be in care versus not in care. And then only 13 states have laws protecting youth in foster care. Kansas obviously is one of those that does not. They have no current laws set for protecting LGBT youth. And then there are 220 youth in Kansas in prison currently that are LGBT. And then risk, victimization, and suicidal statistics. Of all the youth in prisons, 7 to 9% are LGBT, 61% are LGBT girls, and 39 to 50% of those girls that are LGBT are gender nonconforming. And then most are girls of color. And then LGBT youth are detained longer at a rate of 2 to 3 times longer compared to straight youth. LGBT youth are reported higher rates of sexual and physical assaults by staff and peers. 21% of gay and bisexual boys reported victimization by peers, and 15% reported sexual contact with staff. And then in Kansas, 15% of youth attempted suicide in the past year, including 23% of trans or non-binary youth. And then 61% of LGBT youth in Kansas who wanted mental health were not able to access, and 40% experienced threats or harm, and then 75% experienced discrimination based on sexual orientation or gender identity. Does any of those facts or statistics shock anybody, or does anybody have any comments about any of those?
Actually, I think it's sad, but like for myself, I haven't had much experience with it, which is part of the reason I'm here. So it's sad and startling all at the same time.
It is. Thanks for sharing.
Can I share one thing? I'm older. I'm in my later 50s, and I remember as a younger person when people were having children and stuff like that that were older than I am. I remember hearing stories about how families would make decisions based on outward genitalia. And now that I know a couple people that are intersexed, it's so shocking that nothing else was looked at except for one single component. So even if they had non-functioning outward genitalia and their internal genitalia was all female and working perfectly fine, they still assigned them the male because that's what it looked like. And I just can't even fathom what that would be like.
So it's literally based on a refrigerator magnet. That is what they use to determine the size, right? The refrigerator magnet that they use. And that's what they pull off to measure, to determine. And so the issues that come along with that are people will have both sex organs, not know it. And then oftentimes, because of having one, either more estrogen or more testosterone, it ends up leading to cancer. So I've interacted with several intersex individuals whom have found out that they are one intersex later in life, 30s, 40s, even 50s, and then were never told, but always felt different, could never figure out why. and then end up having cancer and then having to go through and have more surgeries and all of the things and all of that. If they had just been told, it would have been a lot easier, and then they could have sought medical care for that specifically, and then obviously made individuals aware. Anybody else? Okay. So other reasons why I like to talk about this topic, obviously, is social isolation, and sexual development for LGBT youth. So when you think about youth and how we learn to interact, or even when we were kids and how we interact, how we determine relationships, all those things, right? We learn about our relationships from our families, peers, social interactions, and media. So how we saw our parents interact are oftentimes how we interact with our spouses, or how we interact with our kids. Or if there was things that our parents did that we didn't like as kids, then we often don't do that or pass that on to our kids, right? All of those things. Oftentimes when you have kiddos in foster care, also, you sometimes have no idea how their families interacted, how they functioned or dysfunctioned, right? Any of those things, which all impact them. And so they're often behind. Or when you think about the data, right? 7 moves per every 1,000 kids in a year. So 7 moves for that kiddo within 1 year, just bouncing homes. They don't have that time to develop relationships, to develop interactions with peers, all those things, right? That are super important for kids. So socialization and lack of representation in peer interactions, peer experiences. Obviously, being a gay person myself, when I was growing up, there wasn't a lot of gay representation. You would turn on the TV, there was not gay relationships. You didn't get to see people having gay relationships and what it looked like to have a healthy relationship versus a toxic relationship. And so all those things I think are super important for kids to see, because at the end of the day, yes, you have your parents, but I think it's different being gay and seeing 2 gay people have a healthy relationship versus my mom and dad, because at the end of the day, it is different. And then data shows that the average age of coming out is between 13 and 17, or between ages 13 and 17 is 13 years old. So these individuals often experience a higher rate of victimization due to that being younger and coming out younger. And then things that kind of help combat this are youth that have access to GSAs, or Gay Straight Alliance clubs, through schools. If your school has a GSA, they're more than 50%, or they're more than likely 50% more likely to feel connected to peers and feel like they belong somewhere within a school, which is pretty staggering, considering that I would say most of the bigger school districts in Kansas have a GSA. And so I think there are super important things to get kiddos involved and even be involved in with yourself as an adult. And then obviously there's concerns for current Kansas laws. There are no current Kansas laws that protect youth in Kansas based on sexual orientation or gender identity. There are no mandates to track or collect data for LGBT youth in foster care in Kansas. There were 11 deaths in 2023, and none of those were reported if the child was LGBT. I do know that one was LGBT. Of those, of the other words, I'm not sure. I just am for sure about one. So adults are not able to change gender markers on driver's license now. That just changed within the past couple of years. And then sex reassignment surgeries are not completed on youth, but they do have access to health care. That again goes back to that kind of stigma or thoughts that we're doing surgeries on little kids, and that's not all the case. Usually what I advocate for is hormone blockers to give the child time to kind of develop and then kind of see how things play out, rather than go to one extreme or the other, and doing meds for testosterone, estrogen, all of those things. And then, so how can we support both as parents, both as individuals? Obviously being a foster parent myself, also being gay, I think all of these are super important. So individuals have the right to express their gender how they choose. So again, your child comes home and says they want to be trans, obviously having conversations about it. What does that look like? What does that mean to them? All those things are super important. So both gender identity and sexual orientation are a part of a person's identity. Let the individual know that you're not going to discriminate, that you can support them while they're determining their needs, accepting them for who they are, understanding that you might not have all the answers, but that you're willing to help and find resources. So I think that it is super important to keep in mind as a parent, and I have to share this all the time, that when your kiddo comes out, it usually is not something that they just on a whim decided today I'm going to be gay and I'm coming out right now. Yes, that's the first time that you're probably hearing it, but it's something that they have thought about, researched, looked into, read about a lot, talked to different people prior to deciding. So while though, yes, it can be jarring, and while though you may have to mourn and kind of think about all the things that can change for your child, all those things, doesn't change who they are at the end of the day. Me being gay has not changed who I am one single day. Yes, it has changed my relationships with family and different things and how I interact and how distant I have to be from certain people, or I know who's more accepting and who's not. But that doesn't change at the core of who I am. I was raised on a farm, was raised ultra Catholic. I'm also Native American, and I'm also Hispanic. And so all of those things are who I am. Being gay is just a small part of that. Doesn't necessarily, that's not my whole identity. That's not something that I broadcast to everybody necessarily, unless you ask. And so I don't think that that's just the only thing that I am. And so to keep that in mind also with your kids. And then I like to throw in these slides as just some responses that you can give or have in mind if someone ever comes out. So I think I might be gay. Some responses. There's several individuals who are gay. Everyone deserves to be accepted and respected for who they are. I'm glad you told me this. Is there anything I can do to offer support? So I'm not sure if I'm gay or trans. Glad you told me. Is there anything I can do to offer to support? Sounds like you're sorting through this. Can be kind of difficult. Can you tell me a little bit more about your feelings about this? What makes you think that you're in the LGBT community? And then here's a list of words with definitions. Sometimes when kids don't know how to identify or are struggling to kind of figure out where they fit in the LGBT umbrella, I always like to give them the terminology and then words, and we discuss, is this how you're feeling? Is this what you're thinking? And then kind of work through that way. And then this is always a really important one. Should I disclose my sexual orientation or gender identity? I really think that it's kid dependent. When you have kiddos who are at a safety risk, I usually do not recommend that they come out. If they do not have a backup plan or somewhere safe to go, I always will recommend that they do not share. Yes, although I think it is important that people know who you truly are when it comes to safety or being kicked out, and not having a plan B or not knowing where to go or who to turn to. I think that it's definitely important to not disclose in those instances. And so some responses can be, that's a good question. Do you have any idea about what you would like to do? What would be the pros and cons of self-identifying? How can I support you through this? And then I'm not able to make decisions for you, but I can offer support, are all things that I think are super important. And then ways to create inclusive or inclusion for youth in foster care, obviously building empathy. Obviously, if you're not gay, you're not lesbian, you're not somewhere on the LGBT spectrum, it's hard to kind of build empathy because you don't necessarily know that experience or what it was like for somebody to even just muster up the energy to tell somebody that you are gay. And so just being able to kind of understand where they're coming from, again, not taking it personal. It's not an attack against you. It's your child or this individual is sharing kind of their life experience or how they're feeling in that moment, and being there and present with them in that moment is super important. So communicate inclusively, again, just kind of maintain, enhance self-esteem so that everyone feels valued and respected. Listening and responding with empathy, and then asking for help. If you don't know how to talk about something, how to bring up something, if your child shares something and you're like, I have no idea, I've never heard of that, right? Doing some own research on your own time, not expecting your child to educate you about all the things. I do think that it is commonplace for parents to kind of probe kids, ask kids tons of questions. I think that it's different if you're trying to get an understanding of kind of where they're coming from versus them educating you. I think those are two different things. And then, of course, including key stakeholders, right? When you're asking about supports and services and all of the things, you got to have the kid in the room, regardless if they're 2, regardless if they're 22. They kind of got to be in the room to be able to identify their needs. At the end of the day, it's impacting them. The decisions that are being made by adults in the room, you got to have the kid in the room to be able to advocate for themselves and let people know what they need. Self-reflecting. Where are you making your assumptions? I think people often too is it's all or nothing, right? It's got to be this way or it's got to be that way. Just like being male and female. Not everybody fits into that box. Again, it's a social construct, something that's made up, right? And so just being able to kind of understand your own assumptions about things. Allow for honest feedback. Creating growth, provide authentic listening, listen for content, intent, emotion. So resolving conflict. Conflict is natural, necessary for any decision making. Everyone has different experiences, points of views, abilities, motivations, right? And then ensuring all viewpoints are heard, evaluated, make sure that youth feel appreciated, engaged, understand diversity, and then and have more inclusive spaces. And then, did you want me to go through these now, Rakeem or Raneem?
Yeah, you can go ahead and go through them now. They did complete it prior to attending, like they did complete a pre-survey, but if you would like to go over it right now, you are more than welcome to.
Right, awesome. I think I got time, don't I? Yeah. Okay, so true or false? Gender expression and sexual orientation are the same. Answer's false. Sexual orientation is, again, who I'm sexually attracted to, who I want to have sex with. Gender expression is how I express my gender. That is, I express myself as a male, cut my hair short, glasses I wear, jewelry I wear, all those things are how I express my gender. Any questions about that? Okay. Question 2. Someone who is transgender can also identify as being non-binary. True. So you can be trans, so you can change your gender, but then also necessarily not be identify with being male or female. I think sometimes that always trips people up. Any questions about that one? Okay. How should you refer to someone if you don't know their preferred pronouns? I also like to preface this with preferred pronouns. I don't necessarily like the term preferred. A preference is like if I like Pepsi over Coke, not who I identify as. Who I identify as is who I identify as. It's not a preference. I don't prefer to be gay. I am gay, right? Okay. So by name, gender neutral pronouns, they, them, theirs. I know sometimes people get caught up. A single person can identify as they. Yes, they can. If you go to the gym and you don't know who had the weights out, they left the gym, weights out, right? Don't know if it was one person, 3 people, you don't know. Pretty simple, just a shift in terminology. And then any questions about that one? All right. And then how would you respond to a youth who says I'm gay? And then some examples. I'm glad you told me this. Is there anything I can do to support? And then the kind of key things to focus on are empathy and understanding. And then, can transgender youth have gender affirming surgery? No. Requirements, they must be 18 years or older, had been in therapy consistently. I think the requirement is a year, if not more. And then have a signed letter of support from a therapist. And that is in order to have any kind of surgery, whether you're doing top surgery, bottom surgery, any of those things. Those are all the requirements for an adult. Again, we do not do surgery on kids. Any questions about that? Okay. I always like to include a lot of other resources. I don't think anybody can have enough resources. Obviously, that's a social worker. And so these are just some really good YouTube channels that have individuals who have transitioned or are non-binary or things like that. I like to include these as just if you want to educate yourself. And then I think they're going to send these out after. And then all of my references I've included.